Hi everyone, and welcome back to another video from Sono Health. I'm Dr. Carolina Melgar. I'm a cardiologist with 11 years of experience, and I specialize in fetal cardiology. I look at babies' hearts every day. Today I want to bring to the table 10 awkward questions that my patients ask me that aren't your usually mommy and baby's health questions. Sex during pregnancy. These are some questions that you usually shy away from, and instead of Googling for some answers, stay and let me share with you all the information I have. I hope this helps. I've gathered 10 questions that our viewers have sent me. So first, let me tell you that sex is okay and healthy during your pregnancy, unless you have complications or certain conditions. With that being said, sex won't always feel the same. So the first question comes to us from Seattle, Washington. Janine wants to know, is it normal to feel pain during sex in your pregnancy? Sex shouldn't be painful in any situation. If it is, consider the position you're in and if there's enough lubrication. Vaginal dryness is very common during pregnancy, especially in the first and third trimesters. If you're having intercourse, this can cause irritation and pain. So to prevent this, try to spend more time on foreplay. This will help your lubrication. If this doesn't work, you can use any lubricant you can find in the drugstore. You might think that lying on your back will be the easiest, but that puts all the baby's weight on your spine. Don't be afraid of experimenting with your other position. What works for you might not be the same for other moms. Instead, try different positions and see which is the most comfortable for your belly. Okay, next we have a question from Amanda from Tucson, Arizona. She wants to know, what are the best positions to have sex during pregnancy? Well, Amanda, every woman is different, so you'll have to try a few positions to see which one works better for you. The most popular positions include side by side, which means spooning, and the woman on top. However, you may find a position that works greater for you, or for now, but feels bad in the weeks to come. Every trimester is different. Okay, now let's see. Alice from Atlanta, Georgia wants to know, is it normal to bleed after sex during pregnancy? Well, seeing spots of blood after sex can be alarming. You might think you accidentally harmed your baby, but don't worry, this happens in up to 25% of pregnancies. Most of the time, small spots aren't anything to worry about. It could be due to irritation from vaginal dryness or cervix changes. Larger amounts of blood during pregnancy can be a sign of miscarriage or an ectopic pregnancy, for example. In any case, it's a good idea to check with your doctor to be sure. Okay, here's Emily from Raleigh, North Carolina, and she says, I'm avoiding sex since pregnancy. Am I normal? Okay, well, first of all, Emily, we're all normal and we're all unique. Having a low sex drive can be very normal during pregnancy. There are a lot of hormone changes, and this can lead you to want more sex or less. Besides all these chemical changes, there could be other factors that impact the way you feel about sex. It just may not feel as good. Positions may be uncomfortable. You could be self-conscious to show your partner your body changes. You could feel stressed about how life is changing. You could be afraid of hurting the baby, especially if you've had a miscarriage before. In any case, your sex drive can change during your pregnancy, and this is normal. Allow yourself that. It's completely fine to take a break too. Communication with your partner is key for them to understand your changes. Now, this question is from Chloe from Portland, Oregon. She says, my partner is avoiding sex during my pregnancy. Why? First of all, please don't blame yourself if your partner's libido has dropped since you became pregnant. In your case, your libido can fluctuate by hormone changes, but your partner's can't. However, in my experience, there are a few psychological explanations. They're worried they'll hurt the baby. They're worried they'll hurt you. They might feel self-conscious about not pleasuring you and could be afraid to initiate. They could also be stressed because their life is changing. There are endless possibilities, but the only way to know is to communicate with your partner. Okay, this one is from Gianna from Long Beach, California. She says, I'm really into sex since pregnancy. Is this normal? Well, first of all, good for you, Gianna. As I mentioned before, your hormone changes can affect your sex drive, and that includes making you want it more. Some women also become more sensitive during this time and feel more pleasure or even more intense orgasms. Now, here we have a question from Madison from Arlington, Texas. Madison asks, Will my orgasms change during pregnancy? Well, yes, Madison, they can change. Every woman is different, so I can't tell you exactly what to expect. In general, the second trimester could be the best organs of your journey. There's no morning sickness, and your belly is not so big to limit the positions. Remember that since you have increased blood flow, that area could be more engorged, meaning more sensitive and easier orgasm. However, by the third trimester, the growth of your baby could make orgasms more difficult. Since you're trying to maneuver around that large bump, you may be in positions that are more comfortable yet less pleasurable. Also, when you do climax, there's less room in your uterus because of your fetus. That means your muscles may not fully contract, leading to weakened orgasms or no orgasms at all. Okay, here's one from Naomi from Tampa, Florida. She says, how can I maintain intimacy without intercourse? I understand. Sometimes, even if you want to have sex, the bump makes it too difficult and too uncomfortable. If you can't manage to find a position you can stay in, you might want to put pause on sex altogether. Some couples worry about losing their intimacy if this happens, but remember that there are some ways to remain connected in your relationship without intercourse. You can start with cuddling or kissing, you can try massages or intimate massages like masturbation. And remember that intimacy can be both physical and emotional. Okay, this question is from Delilah from Henderson, Nevada. Is oral sex during pregnancy okay? Well, if you have a healthy pregnancy, there's nothing wrong with receiving oral sex. In some cases, your doctor may advise against due to some condition, but in general, there are no reasons not to. Now, with any form of sex, you should ensure that you and your partner are STD-free. Remember that oral sex doesn't mean you're clear for infections. And finally, Vivian from Knoxville, Tennessee asks us this question. Will sex go back to normal after my delivery? Well, one thing to know is that because estrogen decreases after delivery, your libido can take a hit. However, my advice is not to worry about that now. Most doctors always recommend 6 weeks before having sex. This gives your body time to heal. Even after you get the okay, you may have to work up to a new normal, but not so much because of your physical condition. You see, the female organs that are involved in sexual pleasure are muscular and elastic. This has been designed this way basically to return to its original state after you give birth. However, changes in your sex drive or pleasure after your pregnancy can be due to, for example, worrying about your after baby body, or that sex will hurt the area after it's been healed, or even getting interrupted by the new baby. Again, I believe that the best way to resolve this is by communicating with your partner about how you're feeling. Remember that foreplay, lubrication, support, and helping out can help revive intimacy. And here's another important thing to look forward to. Research states that women peak their orgasmic frequency in their 30s and have a constant level of sexual capacity up to the age of 55. And there's no evidence that suggests that aging or births affect it later in life. So that's all we have for today. I hope you found this helpful. And if you have any questions, I'll be more than happy to answer them. Just leave them in the comments below. I'm Dr. Carolina Melgar from Sono Health. Thank you for watching.